Great. Okay, great. So, as you said, I'm MK Serwick, and I'm here to talk about the intersection of comics and medicine, which, for much to my amazement, I've spent the last 5 years working there. I've been making comics since about 2000, so almost 15 years, but have started studying this as a thing for about 5 years. So basically, my elevator speech is that I'm a nurse who uses the comics to help contemplate the complexities of illness and caregiving. And I thought I would start this because it's fun with a comic to tell you kind of how I got to this point in my career. So when I was a kid, Amelia Bedelia was my favorite book. Does anyone remember that book? All right, yay. There's always a few signs of recognition. She's a maid, and this character in this book is a maid, and she does literally everything her boss says, and she gets in trouble. But everyone loves her anyway. So, for example, Amelia is told to dress the chicken, and she does. I copied Amelia when Mom said, draw the drapes, but my mom never thought it was very funny. And when a patient is admitted to the hospital, the orders always call for the nurse to draw blood. And the doctors never thought this was very funny either. In nursing school, pathogens made sense to me as characters. And I always explain things to my patients this way. The tests show a bug in your blood, but the medicines can kill it. And it usually works. I'm telling you, Harold, she said bugs in my blood. She said bigger than atoms, but smaller than mosquitoes. I want to transfer out of here tonight. I guess what I'm saying is I was always kind of destined for this comics and medicine thing. I'm comic nurse, and that's the name under which I make my comics. So I was making comics, or I was doing these drawings of little characters and pathogens, and it helped me study, and I would do goofy little drawings, but I hadn't put it together to actually use the form of comics until this moment. And I want to share with you sort of exactly the moment that I can remember very clearly that I made my first comic. It seems like an unlikely story, but I swear to you it's true. So it was around, somewhere around 1999, 2000, I was working, was wrapping up work on an AIDS unit, inpatient dedicated AIDS unit in Chicago. I had been working there for about 6 years, from the height of the epidemic in Chicago until this point where we were actually getting ready to close our unit because we had the medications were working and we didn't need a whole hospital unit dedicated to caring for people with HIV and AIDS. And so I was working the 3 to 11 shift, the evening shift, and during the prior day's evening shift, a patient who I'd known for about 3 or 4 years, whose family I'd grown very close to, the patient I'd grown close to, had died on the unit with us. And it was a very emotional experience. I was very upset about it. And at the same time, we also were getting ready to close our unit. So that was actually a grief experience for me. I had found a real community there. I wanted to be happy, and I was happy on some level, but part of me was really, what am I going to do next? So it's the morning of the day I have to work the next day, again at 3 o'clock, and I'm just really sad and miserable, and I can't figure out how am I going to be present to the 5 or 6 new patients I'm going to meet that day who deserve me to be patient, not hung up on my own stuff, right? We don't ever talk about this in nursing school, or as far as I know in medical school. We don't talk about how you deal with your own grief to really be present to your patients. So I had to try to figure this on my own. My original degree was in English and philosophy, and I wanted to be a writer, so I had tried to write about these things, and words at this point, in the face of all this grief, this compounded grief, were really failing me. And I had been doing some drawing, and that wasn't working either. So sitting in my, in my apartment, trying to figure out what to do, I literally just drew a picture of myself. And I just wrote exactly what I was experiencing in that moment. And for some reason, I put a box around it. And as I said, this seems unlikely, but this truly is what happened. And then it was on the page, and so I just put another box next to it. And what I didn't know at that moment is that the empty space between 2 panels in a comic is called the gutter. And what the gutter does, I like to think of the gutter as asking oral historian Studs Terkel's favorite question, and then what, right? So I feel miserable, and then what? What it forced me to do was go from a static state to move on, like, okay. And the form itself was actually serving me here. So I wrote a few more words, and I made a few more pictures, and I kept going with this. But rather than walk you through the 9 panels of this comic, let's take it to the abstract, and I want to show you, I've reflected on it since then, what exactly happened for me that day, the day I made my first comic. So here's the 9-panel grid that I was working with, and here's where I started. And as I worked my way through these panels with a little bit of text and a little bit of image, I found myself, much to my amazement, here. And that shocked me and thrilled me. And I just kept doing it because I realized that this is a thing that works for me. It wouldn't be till a few years later that I actually stopped and, as I said, during my graduate degree, looked at why did this work for me? What is it? And that's the kind of stuff I want to talk with you here today about. So I kept making comics. These are a few examples. I don't expect you to read that. But basically, again, it was word, image. I was very inspired by someone named Linda Berry. Does anyone know Linda Berry? She was an underground cartoonist who was syndicated for a long time. And she made comics about serious subjects, which gave me the hope to keep moving forward, that comics don't have to be funny. And so basically what these comics do, for me, it was a way of integrating my now and my life off the unit with the kinds of things that I was still thinking about that I'd experienced with patients. And it was a way of using the form to integrate those things. So, as I said, the unit I was working on was closing, and I had done hospice nursing for a while, but I'd lost this sense of community and this sense of purpose in my work. And so I wanted to think about these comics. Like I said, I kept doing them. I actually had an exhibit where I blew a bunch of them up really large and put them on a wall, and wanted just to ask my friends to come to this opening and say, like, should I keep doing this? Is this like a thing? Or is it, should I just move along? And the response was very positive. So I thought, all right, well, what's the next step? I could learn how to draw, perhaps. That might have been a good idea at that point. But I decided rather to look into this field called medical humanities, which is the application of each of the individual humanities to the consideration of medicine. And so I went to Northwestern and got an MA in medical humanities and bioethics. And towards the end of that degree, I was in the Museum of Contemporary Art, which is right across the street from where I was studying. And they actually started carrying this great collection of graphic novels. During my degree, I actually kind of tried to keep it quiet. I was a nurse who wanted to study the medical humanities. But I wasn't really bringing the comics thing to the forefront until this moment, when I was in the MCA and I came across a book called Mom's Cancer. And I remember walking across the room thinking, is that a central line catheter dressing on that woman's neck on the cover of a graphic novel? What is this? That kind of an image was very familiar to me from my professional work. Certainly nothing I'd ever seen on the cover of a book, let alone on the cover of a comic book. So this really rocked my world. And I went home and I read it. This Feast guy is a genius, the author. Look at the insightful critique he's making about the healthcare team. Look at how he breaks down what it's like to be a patient. Genius. Are there more like this out there? This is me on Amazon. Cancer made me a shallower person. Black hole, cancer vixen, epileptic, blue pills, Lisa's story. Has anyone cataloged all of these? Ooh, a doctor in Wales named Ian has. Cool. I'm going to email him to say how awesome his site is. And what I came across was the original incarnation of this site called graphicmedicine.org. And what I learned later is this Dr. Ian was also finishing up a degree, very coincidentally, was also finishing up a degree in medical humanities. He was a doctor who had found the same book in Wales. No, he had found it in London at the Tate Modern Museum, believe it or not, and it really blew his mind. So there were all these interesting parallel things happening, and I found him through this website. So this is him. As I said, he's a comics artist, and he coined this term to mean the graphic medicine, to mean the interface between the medium of comics and the discourse of medicine. And this is what the site looks like now. This is the homepage. It's a screenshot of the homepage recently. And it's been redesigned because there is so much happening at this intersection of comics and medicine right now that we redesigned the site so that it is searchable. So the search bar is at the top. If you have a particular clinical interest area or a particular kind of subject area, you're wondering, is there anything happening, for example, in nephrology in comics? Is there anything happening about diabetes in comics? Those kinds of things, you can go here and search for keywords to find what's happening in that area. So just to step back and let's define some terms. I probably don't need to tell all of you this, but I'm going to do it anyway. So comics, I'm defining comics in this context as sequential art that conveys a narrative and often incorporates text. So you have image, 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 image. And the implication between the images is time, right? It's basically time that goes between this image, and our brains do some really interesting things to assemble story from sequential images. There's actually some really interesting research going on right now about the grammar that our brains use while we're assembling a story. And it's not actually analogous to the kind of grammar we use in sentences. It's a very different kind of grammar. But that's not my area of expertise. So comics, I want to make clear, are a medium. an expressive medium like film, like dance, and they contain within comics many genres, right? So there are superhero comics, there are very serious graphic memoir, they're a different genre. And so I'm sure I don't need to tell you this, but when I talk about the fact that I work in comics and medicine, people think that I draw superheroes for children. But that's not the area that is of interest to me. It exists. It's not something I'm interested in. So to think of comics as only superheroes is like thinking of film as only Disney movies, right? It's reductive and it's not helpful. So graphic novels are basically long comic books. Art Spiegelman, who did a book called Mouse, that you might, anyone familiar with Mouse? Yeah, so it's a comic book about the Holocaust. Nothing funny about that. Graphic novels are a long comic book with a spine that want to be reread. But when people ask me what I do, I say I make comics. So back to Brian Feist's book, Mom's Cancer, that really helped set me to look at this from a critical perspective. He said about this book, comics were the right medium for the story I wanted to tell. They meld words and pictures to convey an idea with more economy and grace than either could alone. And that's the important piece here. So these are images all from his book. This is his mom when she experiences the first symptoms of what will be later diagnosed as her lung cancer. This is her going through the diagnostic process. This is her awash in all of the treatment options and all of the words being thrown at her now. And this is her after her treatment with the consequences of her treatment. And you can see how the medium itself conveys in very unique ways the kinds of communication, the information that he wants us to kind of start thinking about critically. So in, I think this is 2010 or 2011, the British Medical Journal ran the first article that was published about the intersection of comics and medicine. It's by my colleague Michael Green at Penn State. It even got the cover. And in it, I'm just throwing out one more term, is this idea of graphic pathographies, which is basically illness narratives in graphic form. So I want to stop for a second and say that story has a very critical role in healthcare. An entire field in the medical humanities is the field of literature and medicine, and incorporating how stories work and how that actually is relevant for us as people who have life stories that are perhaps interrupted by illness, whether it's our illness, a family member's illness. And there's a lot of really fascinating research and reading to be done about the role of story in illness. And there are many literature scholars who actually take the tools of literary analysis and apply them to illness stories. So for example, to make this more real, you run into your neighbor across the street at the grocery store and her arm is in a cast. Well, you don't just say, oh, I see your arm's in a cast, I'm going to go grab the vegetables. No, if you care about this person, what do you want? You want to know what happened, right? You want to hear the story. And in telling these stories as people with illness, we are actually doing important work. We're talking about where our life was, this thing that happened, and as someone named Arthur Frank talks about, we actually are constructing how our future is going to go in light of this new unexpected event. So we're actually kind of re-world building our lives in light of, oh, I hope that isn't a disaster, in light of spilling water on your computer. That was a disaster waiting to happen. I should have seen that coming. Does anyone have like a napkin or something? You will edit this part out of the film, right? Well, if it starts sparking, we know we have a problem. And I'll count on all the engineers to help me. Oh, thank you. That's super helpful. All right. I think we can survive this. I just did that for dramatic effect. Thanks.
Is the computer okay?
I think so. It's still working, isn't it? I think we'll be okay. All right.
Yeah.
Good? All right. You'll edit this out, right? Okay. So, story has a critical role in healthcare. And I also want to stress when I talk about the texts that I'm going to be showing you a whole bunch of comics in medicine, that most of them are actually nonfiction memoir. And the reason that's interesting to pay attention to is that, so what I'm saying is that the person who created the book actually has the disorder that they're creating the story of, okay? It's not a random, sometimes people work in collaboration, but most of these are memoirs. So it's either the person has lived through the illness and the caregiving or both. So I think that's important because in graphic medicine, we take a page, that's okay, that's okay. We take a page from the disability rights movement, And that sign in Latin there says, nothing about us without us. And that the people best positioned to represent illness and caregiving are those living with it, right? Not the medical establishment, not anyone else, but the people who have this are the best to say, this is what it's like. So, just to be clear, when I talk about using comics in medicine, we're talking about two things. We're talking about reading these graphic novels that I'm going to show you examples from for patient education and for caregiver education. And we're talking about also making comics. People taking up their pens and pencils and starting to do these kind of patient reflection and caregiver reflection, like as I introduced in my origin story, that can happen when you actually draw and use this medium as a powerful tool. In medicine, in the medical humanities, there's a lot of work in medical schools about reflective writing, where they have medical students actually write about their experiences with their patients and how it made them feel. My contention is that I think reflective drawing can be equally therapeutic and important. So, I'm going to answer this with 4 different answers. Why comics and medicine? First of all, comics can help create understanding about the lived experience of illness. This whole notion of what it's like. When you're suffering from something, and many of you probably can think of a personal example from this, what you really want those closest to you to understand, and even other people who may come up and ask you stupid questions about whatever they heard maybe that you have, you want them to understand what it's like. You want them to have some empathy for what you're going through so that they can be helpful or just so that they understand. You want people to know what it's like. So these are a couple of book covers of examples I'm going to show you in the insides of. So this is a book. Has anyone heard of this? Actually, as we go through, if anyone's ever seen any of these, raise your hand, because I'm curious how widespread these books are. So this is a book called Monsters. It's a graphic novel by Ken Dahl, which is a pen name for a guy named Gabby Schultz. And he did this book about being diagnosed with herpes, and he had all these lesions in his mouth, and he started feeling like he used this as an opportunity to explore this whole idea of contagion. And so somehow he felt like, because he had herpes, he started really becoming concerned and wanted to visually explore the idea of what did that mean for how he felt. And so this is a series of images he created that appear in succession in the book to express how he felt as struggling with this idea that he is now contagious and how does this impact his life. And he ends up sort of dealing with this. This is from very early in the book. And each of these virion there start actually becoming characters that he starts having conversations with in the course of the text. And it's a really interesting book. This is another book called Tangles by Sarah Levitt. It's a graphic novel about a woman's her mother's early onset Alzheimer's. And this is a passage from the book I'm going to share with you. Mom, can I come in? Of course. So that's Sarah there, and her mom is in the tub, and they thought her mom was functional enough to be taking a bath on her own. Hi, Mom. Hello, sweetie. Having a nice bath? Oh, yes. Mom's clothes were piled on the floor. There was dried shit in her underwear. The bath water was full of small, disintegrating bits. She was dipping her washcloth into the water and rubbing it over her skin. She had no sense of smell, true, but she could see. She just couldn't recognize. She couldn't recognize shit, dirt, shame, disintegration. There are moments when you have a choice. Fall apart or take a deep breath and just do what needs to be done. Drain the tub, spray the water hard so everything goes down, rinse, wash, rinse, take her hand, let her dry herself, help her with her nightie, tuck her into a warm, dry bed, turn out the light, stand in the hallway outside her door, feel a new loneliness and a new strength. This is a wonderful book, and I love this passage because as a nurse who's talked with family members who are caring for loved ones at home, I think that this really is an example of a situation that in a clinical visit or in a hospital visit, I'm not going to hear this story. But I can read this in this book and have a whole different insight into what a family member is dealing with. And also, as a family member who's been in this kind of a situation caring for someone, it's very empowering to see that represented in the world and put out there. So, this is a book called Marbles, Mania, Depression, Michelangelo, and Me by a Seattle artist named Ellen Forney. No one familiar with this book? This is about her struggle with manic depression, as she says there. And she visually shows us mania and what that feels like to her. And we can contrast that with another image of depression that she shows us here. And we'll revisit this book in a minute. Moving along, this is a book by a British artist named Katie Green. It's called Lighter Than My Shadow. And the irony of this book is actually that it's about the thickness of a ream of paper. It's a very heavy book. And it's about her struggle with an eating disorder and with sexual abuse that happens during the course of her treatment for the eating disorder. It's a beautiful book. So this is a traditional medicalized image of a person with an eating disorder. I just got this off the internet. And talk about the opposite of what I was talking about contextualizing illness and narrative. The person literally has no head, right? They are completely stripped of a sense of story and body. In contrast, this is a Katie's version of her body as she experiences it with an eating disorder. The power of the medium of comics in this usage of it is to communicate what it's like. And for us, this is what a lived, embodied experience of this illness for Katie was like. And we can improve care, if healthcare providers are reading this, by contextualizing illness and to integrate a sense of body and life and sort of put the life back into just these images that we have as healthcare providers. It's just a beautiful book. Katie has said about making this book, the comics had the perfect, I'm sorry, I can't see, there's nothing on my screen. Comics has been the perfect medium for capturing the discomfort that is very real but isn't visible to others. It's been part of a very emotional process of accepting what my body has been through in the pursuit of imagined perfection and in survival and recovery from abuse. So this is an image from this book called The Graphic Medicine Manifesto, which is forthcoming in the spring from Penn State University Press, in which we explore a lot of these ideas of comics and medicine in comic form. Ian Williams, who founded the site, created this, and he said that in graphic pathographies, artists create their own iconography of illness. And this is an interesting and exciting moment in history, because until now, as I showed you that medicalized image, the iconography of illness has previously always been done by the medical establishment, medical illustrators, doctors, and put into textbooks. But this is the first time that the people with the disorders are actually creating this iconography of illness and showing us what it's like for them visually. And in doing so, they're creating new knowledge. They're combining subjective feelings and perceptions with objective visual representations. Okay, so we're continuing to answer this question, why comics and medicine? Second answer, because the medium itself has unique powers. So we're going to see examples from some more books. This is a book called Cancer Vixen, and no, nobody. And it's a woman in New York who is a cartoonist. She had been doing work for the New Yorker, and she was diagnosed with breast cancer. So the context here is the unique power of the medium. This is a drawing that basically does a beautiful job of representing the moment of the night that you've been diagnosed with breast cancer. Trying to go out to dinner and have a normal life, but yet it's always there. And very interestingly, she has the word sort of replicating like cells, that are in her body. And it's a really powerful image and communicates a great deal in a very efficient way. Another panel, a friend of mine who's a bioethicist uses this as, it's a 2-inch by 2-inch panel in Cancer Vixen, but he uses this to represent informed consent. And how doctors need to think about when patients are signing consent forms, are they really understanding what they're being told, right? And I love the patient empowerment piece at the bottom, the last doctor's visit without a tape recorder. Oh, we can take tape recorders. Probably not a bad idea when important things are at stake, and this is how we're understanding information, right? So this is interesting. I've actually given this to a friend of mine who is diagnosed with cancer, and with all the caveats of this may not be your experience, I'd really be curious your feedback after you go through chemo. Is this helpful? And it basically is a chart of days of chemo and energy level. And she wanted to communicate how strong she felt. And my colleague who I gave this to said, this was actually really helpful, because when I was scheduling faculty meetings or my classes that I'd have to keep going to, she said I knew to avoid that center low point, because that's when I'd stay home on the couch, right? Because I kind of got this sense that my course of events was going to be similar to this, and I was going to feel about the worst right around day 10 or 11, and that I could start scheduling things later. So it's an interesting visual that communicates very helpfully. This is another image from Marbles about manic depression. She uses this interesting convention to show us a lot of clinical information about manic depression very efficiently. Moving along, this is a series of 3 books, which this year are going to be compiled into one book, which I'm very excited about because it's a wonderful graphic novel series about by a woman named Carol Tyler about her father's post-traumatic stress disorder after World War II, which of course the generation from World War II never talked about PTSD, they never talked about the war, they called it shell shock that they came home with, and basically the attitude was it's going to go away. And Carol's book here bears testament to the fact that it doesn't. War goes on for 2 generations at very least, right? The family is impacted by it, and she talks about that. And in the course, of course, her parents are elderly, and in the course of being doing this book, she's also dealing with their illnesses and their caregiving issues, one of which is her mother having a stroke. And she uses the medium of comics to interestingly portray the ways in which her mom is impacted in her daily life by her stroke. Another image from Mom's Cancer. This is Brian taking a stab at the medical team, dividing his mom into 2 different specialty areas. Brian, particularly in this book, does a great critique of medicine, and I really enjoy the visual metaphors he employs to do that. This is one of the few, so far, the only not memoir. This is nonfiction, but it's extremely well researched. So Doonesbury, the strip, ran they did a couple of books. Gary Trudeau did a couple of books about war, post-traumatic stress disorder. This one's about traumatic brain injury. And the medium of comics, this is very interesting, gives us the ability to actually show aphasia. Aphasia is when you have you're intact in a cognitive way, but not able to speak the words. So in the comics, we have the convention of speech bubbles and thought bubbles, so we can actually see that he is cognitively intact, but is unable to speak properly because of his brain injury. This is a fascinating thing that comics give us the perspective to do in a very unique way. And I use this quite a bit with my medical students. So if you think of it, this is what the doctor is looking at. So this is the doctor's sight line in a clinical encounter. And the comics medium gives us the ability to contrast that. This is the patient's sight line. So that's what the doctor sees. This is what the patient sees. And from Mom's Cancer, this is what the patient sees. And again, Brian uses as a rhetorical device, this is what this is what the doctor sees, and this is what the patient sees, to show that if this is what this doctor is looking at, she certainly has no business smiling, right? I haven't talked too much about patient education comics, so I have these inhalers up there, because if anyone who has asthma knows, it's actually not easy to tell which are short-term emergency inhalers and which are long-term maintenance inhalers. But there are a lot of kids with asthma, and it's hard enough for adults to figure this out, let alone kids. So a colleague of mine created, Alex Tomics and Gary Ashwell created Iggy and the Inhalers. And this is in the context of how the medium is helpful, and I mentioned superheroes. So what he did was he used character construction to create understanding about the mechanism of action of the inhalers. So this is Bronco, the bronchodilator, and he's a rescue. He'll come in and save the day. And in the course of the comic book that he shows this lasso actually pulling back the muscles in the airway to help make breathing easier. And you see that every superhero has their weaknesses. He only works short term, and that's critical for kids to understand. And then Coltron, again, tying this into the name, is the controller. He's a long-term controller. He keeps it under control, but he doesn't work fast. And so what they did was they created this comic series for kids that helps them to understand these things, and it's really amazing. They've done research to show what the kids who had asthma at these asthma camps they go to do this educational thing, the kids who have the asthma, their understanding of this, it's kind of dicey coming in, but coming out, all of a sudden it's like, and this I think is something that is a wonderful example of comics in action in healthcare. So, another answer. In graphic medicine texts, healthcare providers, we show up as characters. Seeing ourselves reflected in these texts, we can reflect on our practice and perhaps better shape the care that we give and to help fit the needs of the patient. So we're going to do a couple of examples here, actually just 2. One more from Mom's Cancer. This is called The Usual Unusual, and we're going to march through this. At every visit, the docs always say, call immediately if you notice anything unusual. This simple order turns out to be surprisingly hard to follow. So there's mom, the patient. I had a headache. Yeah, don't worry about it. Oh, okay. I had a deep cough. What? You should have called at once. Oh. I feel weird stingers in my head. That's normal with a brain tumor. Oh, okay. I had a leg cramp. That could be a deadly blood clot. Why didn't you call? Sorry. I can't breathe. So you have lung cancer. What did you expect? Right. She's wrong when she complains, and she's wrong when she doesn't. Either way, she feels stupid. How am I supposed to know? And after a while, she stops trying. So, as I mentioned, that I think this is an interesting critique on none of the doctors or nurses realized that they were putting this patient into this sort of unwinnable bind. But I think it's interesting, as I said, if we healthcare providers can see this and we can think, oh, I probably do that to my patients, you know? And we can think about that. And I think it's important. So moving along to another critique of medical practice, we've all seen this, right? Probably had to deal with it, right? And you've probably all heard of an artist named Allie Brash, who has a website called Hyperbole and a Half. Anyone? Yeah, yay, the first, yeah. So she was bothered by the fact that in that slide there, first of all, not all the numbers are represented. That seemed really strange. And also, it really bothered her that that would be the emotional expression you were having if you had the absolute worst pain available to human beings. That seems unrealistic, right? So what she did was she created a different pain scale that had all the numbers and really represented the kind of worst pain we can experience. And if you go to her website, you can read, there's actually explanations for each of these that are pretty hilarious. And that's hyperboleandahalf.com. There's also a book she did called Hyperbole and a Half that has the most beautiful description of what it's like to live with depression. It's called Depression Part 1 and Depression Part 2. And it's been really, really well received in the mental health community and among people living with depression as just a really excellent representation of experience that hasn't been seen before. So I highly recommend her work. So our fourth answer, I think this might be the last one, is why comics in medicine? And comics have a long and proud history of showing us what is elsewhere marginalized, right? You think about comics and underground comic artists and the history of comics. And so I'm going to show you some examples from these books. So something that's marginalized and we don't see and we don't think about is caregiving. And the experience of someone having to wash their mom's hair for the first time, right? That's not something we usually see portrayed. And this is a beautiful book called Special Exits by Joyce Fimer about caregiving her mother and her father. This is a book called Things to Do in a Retirement Home Trailer Park When You're 29 and Unemployed. It's by a guy named Nye Wright, and he is a male caregiver caring for his father and doing all of the things that a caregiver has to do, much of which is very unpleasant. And we don't generally see male caregivers. It's generally women characters that are caregivers, but he uses really interesting animal avatars to represent himself and his dad. It's to a very powerful effect. Images of disability and the simple life difficulties of living with a disability. This is a woman named